Mark Iskowitz, Editor-in-Chief at MM+M, and I'm speaking here with David Laros, who's VP of Analytics and Commercial Effectiveness at Aptus Health. How are you today, David?
I'm great, Mark. Thanks for having me here today.
How can pharma marketers use data and analytics to better engage with HCPs?
When we talk about the customers, right, there's healthcare professionals, HCPs, HCCs, the consumers, IDNs, payers, etc. A deep understanding of all of those is critical. This is where data and analytics is really poised to help the industry. When we take a look at the HCP, we've developed what we call the Aptus Propensity Index. It's applying propensity scoring to help understand the HCP, the provider, how they engage and what type of means and medium that they engage in. Let me explain. We've taken a deep understanding of the profiles, age, gender, specialty, years in practice, their prescribing behaviors for a particular therapeutic class, right? As well as overall, as well as how they treat patients, right? And how they're being promoted to. Utilizing all these disparate sets of data to help predict how they engage in different channels. Right? So it's important. There's such fragmented digital promotion right now. So many ways to engage different customers. So it's important to engage the client, the customer, the provider, on how they like to be seen. That's going to give them a better experience.
David, how can drug makers ensure that the insights that they're getting are the right insights?
Working for a company that provides digital promotion, or working for a pharmaceutical company or an analytical company that provides support for pharmaceutical, trust is the answer. How does a company know that their measurements and their analytics are good? Trust. How do you build trust? You build trust by transparency, collaboration, but also obviously deep, insightful analytics and statistics. And when you tie in a robust analysis that was built collaboratively and transparent fashion, when the results come in, this is very important, when the results come in and they're trusted, the insights that are generated, where it's working, where it's not working, how to optimize, what to focus on next, is accepted, agreed upon, and implemented. That's where trust is so important to help make actionable insights from the analytics.
David, as drug makers face continued pressures on their business models, how can they ensure that the data and analytics that they collect improve how they better communicate their stories and key messages?
You know, the business model in pharmaceutical life cycle companies are changing so dramatically. Rep access is challenged, profitability challenges for pharmaceutical companies, and this is where data and analytics are important, right? To help supplement that, to understand that situation through data and analytics, and help apply and supplement reduced rep access, challenges in that arena, the fragmented digital environment, and to help design campaigns that are messaged appropriately, but only through the channels that the individual responds to. The patient, very similar situation, to help understand that and to incorporate things like the geographic information systems, deep understanding of the patient, but also to connect those two, right? And to have a campaign with synchronized promotion to the doctor or the provider as well as the patient. And actually, for example, do point of care promotion with synchronized promotional engagement type of communications to help guide the end goal, the information that's trying to be received, but within that context of the point of care. And when you're in that context of the point of care, you end up with a situation where data and analytics could help drive the right messages right there, which both the customer and the provider enjoy and respond to, and be able to create a better user experience and obviously more and better impact.
And when is the patient more in a healthcare state of mind? When they're in the doctor's office?
That's exactly when they're most concerned about their healthcare.
Great. David, thank you for joining me, and thank you everybody for watching.